Hello, I'm Anita, and this is Care Experts, brought to you by CareCredit. The CareCredit credit card can help you get the look you've always wanted now. CareCredit is offered at hundreds of thousands of locations nationwide for things like cosmetic surgery, injectables, and other beauty procedures. Today, we're in Los Angeles, California with Dr. Sherly Soleiman. Dr. Soleiman is a board-certified physician and injectables specialist and the founder of the Cosmetic Injectable Center in Sherman Oaks, California. Dr. Soleiman, today we're going to talk about injectable fillers and Botox. So first of all, can you tell me what exactly are injectable fillers?
Fillers are substances, because there's options. I say that plural because we have different options. That are placed under the skin to create either volume, fill a line, or potentially even change the facial structure for maybe a more feminine face or a more masculine face, so gender-affirming type procedures.
So what are the different kinds of dermal fillers and what do they treat?
So there's a few different types. The most common one is hyaluronic acids, which are instantly reversible. We just have an enzyme we inject and it instantly goes away. Hence the safety nature of them. And then there are a few other types, such as calcium hydroxyapatite. It's white in color and it emulates more of a bony type structural support. And then there's PLLA, which is polylactic acid, and that is good for just spreading and overall volumizing. It just spreads and creates that overall reinflation of the face.
And how long would these dermal fillers last?
Depending on the type you use, there's some that last as short as 3 months, and then there are those that last over 2 years.
And then what happens when they wear off? Is there something that is going to change about the structure of your face?
As long as you haven't gone into extremes, the skin just goes back to where it was initially.
And are there any specific risks that you should know before you decide to go with fillers?
So there's the common risks with any injections or let's say even blood draws. And those are things like bruising, swelling, or with fillers, there's also possibility of some lumps and bumps initially that usually go away. If they don't, like I said, there's reversing agents where you can just shave off a little bit just to make it more even. Larger risks could be things like having an allergy to the filler, or let's say if it clogs the traveling of blood inside of a vessel. And if that happens, again, I would have the patient call me up immediately if they see anything that is unusual, and we reverse it, and we can always re-inject 2 weeks later.
Let's talk a little bit about under-eye filler. So what exactly does an under-eye filler do?
So there are people who genetically just have hollowing under their eyes, and then there's aging that takes place for others where the lid-cheek junction lowers. And so the fat on the cheeks just sinks down a little bit and creates a space in between, which usually gives people a tired look. So usually people, whenever they come in and say, I look tired, that's a good signal for me that their under eye is probably deficient. It's just, I had to have hollowing there. It just creates these dark circles. So by filling that area, it just gives the face a more energized, lifted, happier look.
Got it. And what exactly is Botox, and what would Botox be recommended for?
So Botox is very different than fillers. While fillers volumize, Botox relaxes muscle, right? So by relaxing the muscle, it doesn't do anything to the skin other than just relaxing the muscle that's underneath it.
Okay.
So when you relax the muscle, it doesn't contract, and hence the skin that sits in front of the muscle isn't going to fold as much. So it doesn't scrunch up the skin in that manner.
And how long does Botox usually last?
When used in optimal dosage, then it can last anywhere between 3 to 4 months. Usually, there are people who are a little more sensitive, and it can go as long as 6 months. But even those people that are sensitive, sometimes with time, the body figures out how to get rid of it, and they normalize. And they, again, end up being about 3 to 4 months.
Got it. And how would you help a patient decide between Botox and filler?
I love using them in conjunction. So if I need a muscle to stop contracting, I'll go with Botox. If I need to hydrate an area or reinflate an area on the face, then I'll go with fillers.
We'll be back with more Care Experts after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back to Care Experts. Let's continue our discussion on injectable fillers for men and women. Now, do either of Botox or filler painful when you're getting it done?
That depends on the technique used. We, at my office at least, we use the smallest needles available. We have all forms of numbing agents. We've got laughing gas, it's called nitrous. We've got numbing creams, numbing injections. We tend to use cannulas, which are less painful because it's not sharp at the tip of the needle, so it doesn't cut, it reduces bruising.
And how much on average would Botox or filler cost a patient?
Some people charge by the area, others we at our office charge by the unit on most things. Then the price can go up or go down, and there's packages like a whole face. So it just depends on that. It could be as low as, let's just say you're having a lip flip done. The lip flip itself could be anywhere between $30 and maybe $100, and you could have a whole face done. That could cost you somewhere between $5,000 to $10,000.
And what kind of financing options do you offer?
We love our CareCredit. It just gives our patients ability to pay it over time. We've got credit cards that we accept, and that also helps patients. And of course, we try to keep the prices very affordable. So as patients do more procedures, we try to help them out by reducing the cost.
And Dr. Soleiman, what would you say is your favorite part of your job?
Someone was asking me, why do you work so hard? And why don't you just take more time off? And I'm like, well, what would you do if you take time off, right? And he told me you could go on coffee breaks, you could go to lunch. And I'm like, well, I'm just doing that. I end up having fun with my patients, talking to them, enjoying their company. Just instead of coffee, we're doing it over injectables. So I can't tell you how fortunate I feel to have found this job.
Yeah, it's wonderful when you don't feel like your job is work and you already feel like you're on a break.
I agree, and I meet a lot of cool people, so it's great.
Thank you so much for taking the time to talk to me today. I so appreciate it.
Thank you for having me here.
Thank you for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. Visit CareCredit.com for more information.
Thanks for joining us on Care Experts with CareCredit. If you enjoyed this episode, please subscribe and share with friends and family. And stay tuned for new episodes every week. Through October 31st, 2022, earn an entry for your chance to win $2,000 in the Let's Get Digital Sweepstakes. Enter the secret word FILLER in the Sweepstakes Hub to earn one entry now. Head over to the Sweepstakes Hub by simply visiting carecredit.com/Let's Get Digital. No purchase necessary. A purchase will not increase your chances of winning. Legal residents of the 50 United States and U.S. territories, including D.C., 18 years of age or older, who have a CareCredit credit card as of 9/6/2022. Void where prohibited. Promotion starts 9/7/2022 and ends 10/31/2022. Sweepstakes prizes are awarded in the form of a check. For official rules, including odds, free method of entry, and prize descriptions, visit carecredit.com/Let's Get Digital. Sponsor Synchrony Bank, 170 Election Road, Draper, Utah, 84020. Purchases with the CareCredit credit card are subject to credit approval. Minimum monthly payments required. See carecredit.com for details. This content is subject to change without notice and offered for informational use only. You are urged to consult with your individual medical providers with respect to the information presented. Synchrony and any of its affiliates, including CareCredit, collectively Synchrony, makes no representations or warranties regarding this content and accepts no liability for any loss or harm arising from the use of the information provided. Your participation in this presentation constitutes your acceptance of these terms and conditions.